everyone, my name is Shelley Anthony and I am a dental hygienist with Senior Dental Care. I currently live in Florida, providing care to the nursing homes in the greater Jacksonville area. I have been practicing dental hygiene for about 27 years and I'm really excited to be with you here today. Thank you so much for taking the time to watch this webinar. If you have any questions, please submit them in the Q&A box below. Dr. Fletcher, one of our dentists, as well as Jeannie Jandek, a fellow hygienist, are standing by to help answer any questions. And if you're watching this at a later time, you can always email me at santhony@myseniordentalcare.com. In today's webinar, I will provide the caregiver with recommended dental aids and products to help better deliver oral care to the resident. I will also review the use of dental aids to assist the caregiver in providing oral care to the resident. Now, it's important to note that all dental products need to have the ADA seal of acceptance. This will ensure that these dental products have been evaluated for safety and effectiveness. So let's begin with toothbrushes. If you're using a manual toothbrush, you want to select a toothbrush with soft bristles and a small head. You also want to select a larger handle. This will provide an easier grip and better control. Now, if you are assisting a resident, again, want to use a larger handle, but these handles can be modified with a ball or a foam wrap. What this does is it increases the diameter of the handle to help for better comfort, grip, and control. Ideally, an electric brush is recommended just because it's easier for the caregiver. All you have to do is place and go. You don't have to manipulate or apply pressure. None of that is required. And all of these electric toothbrushes do have larger handles, which helps for better control and a more comfortable grip. There are two types of electric brushes. You have a battery operated or a higher end electric brush are your rechargeable base. Now, the electric toothbrushes with the rechargeable base typically will come with a 2-minute timer on them, which is extremely beneficial because that's what we recommend for the amount of time to brush. If access is a problem and you're unable to use a toothbrush, you can always use an oral swab or a washcloth. Oral swabs can be used to remove plaque and food debris out of the mouth. You can do this by dipping it in an antibacterial rinse or just plain water. Oral swabs can also be used to apply fluoride gels. And if you don't have an oral swab, again, you can use a washcloth. Next are floss aids. The first floss aid is a floss holder. Floss holders come with the longer handles, which make it easier to maneuver and control and grip. Now, the way a floss holder works is you take a specific amount of floss and thread it onto the floss holder. It's very easy to do. The second type is a pre-threaded disposable floss pick. These come in different sizes and different handle shapes. Both are really easy to use, and you utilize them by sliding the floss in between the teeth gently and rubbing it on each side of the tooth, removing that plaque. Ideally, when you take the floss pick or the floss holder out, you want to wipe that floss off or rinse it before you go into the next area. There are also interdental aids, proxa brushes or interdental brushes. And these come in a variety of sizes and shapes. These brushes are ideal for when there's spaces between the teeth. Depending on how large the space is going to determine what size of brushes that you're going to use. These brushes are applied in between the teeth in an in and out motion. Again, rinsing the brush off or wiping the brush off of plaque before you take it into the next area. Toothpicks are also really good to use. They're called Stimudents. Now, unlike a regular toothpick, your Stimudent has a blunt point, so it doesn't injure the tissue, which is fantastic to use. And this is a really common interdental aid because toothpicks are so easy to use and everybody's always used one. It's really important to remember that we must remove plaque and bacteria off of our tongue, and this is done with a tongue scraper. Tongue scrapers come with a very long, easy to control handle. They're used by starting at the back of the tongue and scraping forward. Again, you will rinse that scraper off or wipe it off before you go back in to scrape again. By using a tongue scraper, this is going to help reduce bad breath, since bacteria that is located on the back of the tongue is a contributing factor to bad breath. It also opens pores and leads to better exposure of taste buds, and this enhances our sense of taste. Now, all of these products that I have talked about can all be better utilized if we use a mouth prop. Mouth prop helps to keep the mouth open. They're made of foam, plastic, and you can even make one using a tongue depressor and gauze. You wrap the gauze at one end of the tongue depressor like a cushion, and this helps the caregiver with better access and greater safety and control. So let's talk about over-the-counter rinses. The first type of rinse are your antibacterial rinses. That's Listerine Zero or Crest Pro Health. Both are antibacterial, which reduces plaque and bacteria, and both of these are alcohol-free. You always want to use an alcohol-free rinse because that is a contributing factor to dry mouth. Dry mouth is a common condition with our residents. So, like I said, they're both antibacterial and alcohol-free. The next type of rinse are your fluoride rinses. That is ACT, A-C-T. It's a fluoride rinse. This rinse is also alcohol-free. It reduces sensitivity, and it also helps prevent cavities. Now, like I said before, a common condition with our residents is dry mouth, and this is contributed to a variety of medications. If patients are undergoing radiation therapy, or if they're diabetic, or if they have autoimmune disease, they suffer from dry mouth. And the number one recommended dry mouth rinse is biotin. Biotin contains moisturizers and lubricants. It is also clinically proven to soothe and moisturize dry mouth for immediate and long-lasting relief. Biotin has a large product line to include paste, gel, rinse, spray, or even lozenges. Now, depending on which product you use, it's very important that you follow the manufacturer's instructions. Lastly, and probably most common, is our denture products. We'll start with a denture brush. A denture brush these bristles are specifically arranged and designed to fit into the denture. You also want to use a non-abrasive denture paste like Polident. Do not use toothpaste. They're too abrasive for the denture and can cause microscopic scratches. Now, when you're soaking dentures and partials, you'll use a cleanser solution or tablets such as Effordent, and this reduces and kills bacteria. Fixodent, Polygrip, and C-Bond are all three types of adhesives. They come in powder, cream, or wafers. It's important, depending on which product you use, again, that you follow the manufacturer's instructions. But it's also important to note that these products are only used for a little bit extra security. By no means are they recommended as a permanent solution to ill-fitting dentures. So as you can see, the use of dental aids can significantly ease access to oral care, which in turn will improve oral health for our residents. Dental health and daily oral care, to include recommended dental aids and products, are crucial for our residents' overall health and quality of life. We hope you have enjoyed this webinar and it has been informative and helped to better explain how these recommended dental aids and products can benefit the caregiver for an easier delivery of oral care for our residents. Please be on the lookout for a follow-up survey. We greatly appreciate your feedback. And from the entire Senior Dental Care team, thank you so much for all that you do.